So this is a greyhound with a distal femoral lesion suspected to be an osteosarcoma. There was some initial concern that he had, or she had a met to the lungs on radiographs. So we did a CT scan 2 days ago and there were no mets. So we're going ahead with the amputation. So we're just going to start immediately first. Now let me just reposition this just a little bit, sorry. And so I'm just going to incise through here. Now, being a greyhound, the problem is them having post-operative bleeding. So we were going to start on aminocaproic acid. I'm just going to get you to, yeah, that's great. Which was the originally published protocol to minimize the risk of post-operative bleeding, but aminocaproic acid is no longer available, so I found out. So now we're using tranexamic acid. I'm not sure if I said that the right way.
Tranexamic acid.
Yeah, that. And so he had a bolus. He might be on a CRI, which is one recommended technique. And then we'll continue on with the IV bolus over the next 24 hours and send him home with 5 days worth of oral tranexamic acid, or that, whatever you call it. I'm really bad at pronunciation.
Well, blame the accent. Why not?
So I'm bad with languages. I cannot say Ollie's piano teacher's name for nuts, and it's a common French name. And I try, and Ellie and Ollie make fun of me, but I try. Oh, can you hit the button so we can get the harmonic scalpel? So there's a femoral triangle here. It's our femoral artery here, and our femoral vein here. So actually, I might just probably get a better view if I swap these. So I'm just going to swap these around. Okay, so there's a better view of the femoral triangle there. So we got the pectineus muscle here, the gracilis muscle here, or adductor muscle, sorry, I think, adductor, gracilis, adductor. And then we got our femoral artery here and our femoral vein here. So this is where I like to use DeBakey's rather than anything else. I'm going to try and get in here without. So once we've got these controlled, and you might just be able to see in here one of the circumflex femoral vessels, which you have to be careful of because they're the ones that will get you. So there's our femoral artery, more or less isolated. I'm just going to get our femoral vein here. Sorry. Okay, great. Okay, so it's pretty good there. Thanks. I'm just going to dissect up a little bit more. This is just going to give me enough room to put our proximal one on. And then we'll put a transfixion in between these two. Okay, so I'm just going to put a transfixion closer to the one that's going to be retained down here. Again, I do this one last just to minimize the amount of bleeding that we get. So we'll come through with the harmonic scalpel between those two. This might be a vessel coming off behind there. Okay, so there's, you get a better view of circumflex femoral vein here. So as Jesse just said, they are sneaky, and there's another circumflex femoral artery there. So those are the ones that get you. You kind of forget about them unless you've been hit in the face by them, and then you don't ever forget about them. Oh, sorry, that's me. Okay. Yeah, let's get you to bear back like that. That's it. So I'm just going to try and get another one as far proximal as possible. I don't typically do a transfixion on the vein. For a large dog like this, I will do 2 circumferentials. Okay, so that. Okay, and so it's got some still large vessels behind there, but let's see. Yeah, let's come there. Just going to get through the Bactinias here. I prefer to use the harmonic scalpel rather than a ligature for this, just because it produces heat through vibration rather than electrical current, so we don't get any of the jumping of the muscles as we transect through them. Okay, they are pretty big vessels, bigger than usual. Let's do a encircling ligature around all those three. Got that branching off around there too. Okay, that's going to improve our visualization there. Let's come through this muscle now. Okay, so let's just come through this way. The joint should be right underneath here. I'm just going to have a quick feel. Oh no, it's further back. It's under here. So I'll get this muscle. So we've got a little venous bleed there, so we'll see where that's coming from. there somewhere. Okay, good. Looks like it's coming off that vessel there. Okay. So, I'm trying to access that joint again. There's our femur. Femur's there. Okay, so I think we're through there somewhere. This is a big muscle, obviously. So this is where using a ligashura harmonic scalpel is a little bit slower, but I think the compromise is you get better hemostasis compared to using electrosurgery. I forget the actual details, but there was some discussion on the VSSO listserv recently about the degree of inflammation caused by ligashura or harmonic scalpel while doing an amputation. And some people were not doing it or not using them because of that reason. But I certainly haven't appreciated any problems with using a vessel sealing device in this situation post-operatively. In fact, more the opposite. I think we don't see as many seromas and hematomas. Branch there. Okay, so we've got the femoral head just here. So we're just going to incise through with the, I'm just going to get that first. Might just try and incise through this part first for some pre-visualization. Okay, so while trying to avoid that big vein there, we're going to incise through that with the cautery. So that feels like it's above there.
Or I just have to take it up.
Got a nerve there. So it's a good, this is the ligament of the femoral head just coming in here. So I'm just going to incise through there to disarticulate. I think I got most of it there. And I'll come around, get more of the joint that way, but we'll do the rest from the lateral approach. So just let's go through here, then we're going to switch to the lateral approach afterwards.
Local from the girls with the head.
Yeah, just. Sciatic there, maybe. So that's our sciatic nerve just coming in there. We'll get it from the other side. I'll just come through and get this muscle over here.
Yeah, towels.
Yeah, we may as well do this while we're here. It's actually a pretty good view of it. So this is just ropivacaine into the sciatic nerve. Looks like a good amount. Okay, so we're just going to switch to the lateral approach now. So we're going to connect these two incisions. The thing with the lateral skin is it is quite tightly adhered to the underlying muscle, fascia. So you do need to do a bit of blunt dissection to get that away. I'll just reposition this, sorry. Like the Blair Witch Project. Probably all got motion sickness now. Okay. Pretty good back there. Okay, so the hip's all the way up there, so I'm just going to undermine this. So hip joint's just here, so we should have enough dissected away. Okay. Just grab that one because we're probably below that, I suspect. This one there as well. Okay, so now we're just going to come from, I'm right-handed, so I'm actually going to come from a right to left approach. Mm-hmm. What's that?
I know, sometimes the growth is me too.
I don't understand.
Okay, but then you get a nice steak in front of you and you forget all about it.
What if you see like a left or a right or something? You don't care.
Yeah.
How could you not like eating meat?
Yeah.
Like, this is like, it just needs to be a bit marbled in there,
Yeah.
like. I think this kind of thing just either, it just reaffirms your choice. You either love a good barbecue or you love vegetarian.
Do you smoke meat at all?
What's that?
Do you smoke meat?
I do. I've got a smoker up at the cottage.
Like the egg thing?
No, it's a not a not one of the
Not
big
one of the
ones.
trendy ones.
But it's an upright one, so I could.
I will cook meat for I'm used to,
That's nice.
but I like insist on gloves. It's like preparing the Christmas turkey. I went through like 6 or 7, 8 like pairs of gloves.
That actually makes sense anyway. Particularly if you handle it when it's raw.
I do find vegan food really tasty though.
Yeah.
Like, you know, when I go to restaurants and I have it.
Oh, like
Because
if,
they compensate
if they've
for it.
like put thought into it, but like if you're doing it by yourself, just like cheese, butter,
Um,
everything. I think it's more just that I don't like food that my teeth have anatomy.
There's a lovely sciatic nerve there.
do you have meat in Georgia?
I think next week.
But like back in the city?
Oh, probably on the weekend.
We go to Femoral.
Yeah. Did they not ask you to pick them up? Do you have extra?
No, I could though.
Yeah.
Okay.
Message me if you need to.
Yeah.
Are you okay to close this after?
Yeah, of course. No worries.
Let's come through here. Okay, so there's a sciatic nerve running from around down here. So we've already blocked that, so we're just going to come through now.
We did.
I don't believe in it. I don't believe in it. No, we did it. We did it from the medial side.
So that it could sit there a while. What happens if you lose it?
You can tell you've got a good block on the sciatic if it doesn't jump when you transect it. So our anesthesiologist can feel relieved that we did actually block it.
That's supposed to see because it looks the same like as it does on ultrasound when you're doing the ultrasound guys. That kind of looks.
Okay, so I just need to come through. Need to come through the cranial tibial here. Cranial sartorius, sorry. Can you hit the button?
Go talk to Phil.
Me?
Yes.
Okay.
I don't know. I mean,
Not recording?
when I walked by, like, as you were drinking this, I was like, they're bored. So.
Settle?
Hmm?
Settle, I said. Here.
I have an unstable, primage diabetic, and I want to send it for surgery. And Courtney is just like, what surgery?
So now we're coming to the gluteals and the hippoductors, and once we're through these, we'll see what's hanging on.
Hello, Julius.
Hey, Phil.
How are you?
Good, yourself?
Good.
What you got?
Is now a good time?
Yeah, sure. Yep.
I just have this patient that's presenting on reject, 8-month-old, female stage, I believe, Chow. She had a left proximal tibial salter harris fracture repair end of October. Corners had issues.
Is this with me or you?
Pardon me?
Is this with me?
It was Jeff that did this.
Okay, yeah.
I'm just seeing it through reject.
Okay, no, I was just making sure it wasn't.
There was things going on in the owner's life such that they couldn't come back for a recheck, but the dog is kind of persistently lame. I'd say generally here in hospital doesn't use the leg all that well. When she forgets herself, she'll be using it. Like she's putting it down when she runs with her sibling. It just appears like there's probably like thin related irritation around the joints, some are very close to the joint ligament surface. So I was wondering if you had time for an explant. It was booked as a sedated procedure, but some of them are just too deep that I don't think that we'll be able to get them with the sedated procedure.
Mm-hmm.
They're okay with the pin explant post.
Okay.
Matt would be happy to put her down for you. I know
Okay.
you haven't seen it before, but do you think that that's something you could do? Otherwise, we'll
Yep.
reschedule it.
No, we can fit it in today.
Yeah? Okay,
Yep.
perfect. I'll get things lined up.
Okay.
Thank you.
Get that one.
Not for you to say the Foley. Yeah. Foley from Friday
never
was
know.
my favorite. That was just so fun.
Yeah. That was nuts. Did you do nothing?
He went home. He's
Yeah.
not eating it. I need to get him back in for an EG. He's just got like an upper rest infection, so he's like all stuffed up and he doesn't.
So let's get through that joint here.
I feel like if you can't smell, you don't want to eat.
Yeah.
So we're almost there. Just getting through the joint capsule. Let's just take it through that way. Okay, so there's an amputation complete. And so we're going to, one of our VAs, our veterinary assistants, loves doing the dissection. So she'll take out the femur and we'll submit that for analysis. And then we've got nice muscle coverage over the surgery site, so that'll be nicely padded. It's obviously a well-muscled dog. And then close like that. So Jesse and Matteo are going to take over from here. And I'll see what the other surgery's looking like and do some surgery reports. And we'll see you for the next one. Okay. So depending on what's happening on the next door one, we might stop this one early, the feed, because the next one is pretty exciting. Sure, yeah, thanks.